Welcome to the Man Cave Podcast with Dan Casper.
We usually hear him on Friday mornings around this time. He's Dr. Austin Crowe, Chippewa Valley Orthopedics and Sports Medicine. And I don't mean this in a negative way, Austin, but usually when we have you on for a special segment, it probably means something bad happened. So
yeah, it's kind of like being on call. You know, you get called in for the emergencies.
Yeah, exactly. So we appreciate you taking some time this morning because a lot happened yesterday and in the last couple of days here. So obviously, I want to start off with Micah Parsons. Now, I know there's reports out there saying it is an ACL injury, but when I was talking with you yesterday, you mentioned something that you saw on the replay and on the video that you thought really indicated that it was a torn ACL. Can you kind of explain what maybe you saw in that video that kind of, red flagged it for you that, yeah, that's probably going to be a torn ACL?
Yeah, so, the first replay from the side, you kind of saw like a little bit of a buckling, but it was that second clip where when you're looking straight on and you saw his knee fall in and then do like that, it was like basically like a little shift. So what's happening, you can visibly see the ACL tear, and what happens is the tibia shifts. And so the knee falls in, we call it valgus, and then there's a little rotation that goes with it, and then you see the pop. So, I mean, I would be willing to bet every dollar I have that it's a torn ACL. I mean, that's just absolutely what it's going to be. So the MRI, I can pretty much guarantee is going to confirm that. Obviously, the hope is that's an isolated ACL, not any additional meniscal or cartilage-type injuries. Now, ligament-wise, I don't think any other ligament's likely to be injured with this type of mechanism, so it's unlikely to be an MCL. Certainly, PCL, LCL should be fine. So it's almost certainly going to be that ACL. Again, it's that video where you look straight on, you literally just see that knee buckle in, and there's actually like a pop and things shift just for a subtle second, but that is very, very telltale sign of a torn ACL.
So obviously, you I don't know how many Packers fans have been reaching out to you or asking you, but I'm sure a lot of fans are like, okay, so how soon can he come back? The recovery, and this is something we've talked a lot about with ACLs, right? I mean, not everybody's Adrian Peterson who can just come back in a matter of months and such. We know Micah's an elite athlete and such. But I guess my question to you is, like, when you perform an ACL surgery, is there anything that you see during the surgery that may give you an idea on recovery time, or is it essentially based all on how the athlete is recovering in the rehab process?
There's multiple things that go into it. I mean, one of the biggest ones on the way in is, like, what's the injury pattern? So, I mean, not all ACLs are created the same. So, I mean, you'll come across some ACLs where it's a situation where there's what we have these additional injuries. Some of the most dreaded ones, of course, being our cartilage injuries. But sometimes you'll have multiple ligaments involved. Sometimes you'll have significant meniscal tears, and those all play a huge role in the recovery timeline. Often, especially out the gate. So let's say he has a meniscus that needs to be fixed, then he's going to have limited weight bearing. If it's just an ACL, sometimes they can start walking more quickly. All those things play a role in how the leg recovers. And so kind of once you're past that first hurdle of like, what do you actually need to do and what do you actually need to fix, then it comes into like, how's the leg respond to the surgery? So there's some people who come back at the first visit and just there's marked atrophy, excessive swelling, stiffness. And it's not like the surgery went any different. It's just kind of like the body's responding to the surgery differently. On the other hand, you have some athletes who come back and it's like, wow, your leg looks pretty dang good. They just, when they come out the gates like that, they just tend to recover more quickly. Now, there are certain timelines that we just adhere to. So really very few surgeons do, and they really shouldn't be going earlier than 6 months. So 6 months is the absolute earliest. Often we're looking at more of like a 9, and you're starting to see, especially in these, NFL, NBA type athletes, they're actually waiting a full year. And there's not really any hard data to say 6 months versus 9 months versus 12 months. There are studies that are starting to show that the longer you wait, the lower the re-tear rate is. Of course, at some point you say, hey, the leg looks good and it feels good. Let's get back out there and play. So my guess is to try to put an actual timeline on it, I would guess 9 months would be a very solid guess of and he'll have his surgery in all likelihood in the next week or two. 9 months from now, he'll be back on the field would be a good guess.
And then he wasn't the only star player over the weekend to tear an ACL. Patrick Mahomes, I mean, first off, the Chiefs eliminated for the postseason, first time since 2014, or I believe was the year. I mean, I think
Yeah,
I saw.
I think so.
Yeah, I think I saw a graphic too. This is the first playoffs that we haven't had either a Tom Brady, Peyton Manning, or Patrick Mahomes in the playoffs since 1998. For crying out loud! So, yeah,
That's a crazy stat.
you're right, exactly. So I don't know if you witnessed something similar in that video clip to Patrick Mahomes' ACL, but I mean, he really struggled to get off the field and really needed help. And it's weird too. I don't know if this is. We see guys getting helped off the field like Patrick Mahomes, who had a torn ACL, but then we see guys who just look like they're walking normal. I mean, is that just could it be a different type of teared ACL, or is it just pain management? Is there something to that effect?
Yeah, I mean, you are right. There are guys who will trot off. I mean, occasionally we'll get an athlete who just says, like, I think I kind of dinged my knee. They'll finish the play.
Yeah.
And then you examine the knee, and you're like, I think you might have torn your ACL. And then, they look at you like, what? And other guys who are on the field, like, screaming. It's not about how tough you are. I mean, there's always, different levels of energy that go into an injury. And so I think how much of that energy is imparted into the knee. You get really severe bone bruises, sometimes not quite as bad with others. Like I mentioned, there's also sometimes additional ligaments torn. So back to your first question on Mahomes' video, you certainly could tell right off the bat it was a serious knee injury. He was getting wrapped up and he stepped awkwardly and the knee did a little kind of a buckle. His definitely buckled differently. So with his, I would be more concerned about a potential multi-ligament knee because there was as opposed to valgus where the knee fell in, his looked like it almost buckled out a little bit. So then it raises the risk of what we call a posterolateral corner injury. So if his was a posterolateral corner plus an ACL, that's a more significant injury. I'm not saying it is for sure, but the mechanism certainly looked different. So Micah was a classic non-contact guy cutting and pivoting, knee falls in. I mean, that one, again, you can take to the bank at the torn ACL. Mahomes is, you're like, geez, I wonder, you knew something happened, but it's harder to tell exactly what the injury pattern would be. Now, they've already said ACL, so I don't know if he already has had his MRI or if they're just going on exam alone. Sometimes the exam is very, very convincing, but I wouldn't be surprised if he has additional injuries, whether it be ligament or meniscal, because his really had in some ways almost a more awkward load, and he also kind of had his weight and the other guy dragging him down, so it's a lot of energy that goes in that knee. So I'm a little more concerned on his.
Does it? Because I know the Chiefs came out with a statement with Mahomes, and one of the lines in there I thought was, maybe this is just kind of a generic thing, but they said the Chiefs and Patrick Mahomes are going over surgery options. Does that give a tell to anything that maybe it's just more than an ACL injury?
Potentially, yeah. I mean, it also maybe he's shopping doctors, so they'll have a team, like their regular team physician. A lot of times those guys like to go see other doctors. I mean, the irony is in the end we all kind of do the ACLs the same. So, but it is what it is. I mean, that's part of like the whole sports medicine. There's some big names out there, and they just tend to draw on some of the big athletes. And you come to Eau Claire, Wisconsin, you get your ACL done the exact same way. So it's kind of interesting how that all works. We all train at the same places, so it's really an interesting phenomenon how that works. But these guys just have reputations of like, I take care of the elite athletes. So it's probably going to be that. And then they may also be looking at timeline as well. So depending on what the injury pattern is, there are some that we want to get back ASAP, some that we do actually wait a little bit. If there's really marked swelling and stiffness and they can't bend their knee well, sometimes we will give it a week or two to get some of the swelling down so the knee range of motion is a little bit improved. And again, just based on the severity of what his looked like, maybe his is going to need a little bit of that TLC. But obviously that time will tell. But I would read it more as I'm going to shop around and we're trying to figure out the timeline truthfully, but obviously you never know for sure.
We had quite a few listeners wanting me to ask you, obviously, about Christian Watson yesterday because we saw the play. He looked like he was grabbing his shoulder. The Packers called it a chest injury. Apparently, he did go to the hospital, did fly back with the team. But, I mean, when it looks like a shoulder but they're calling it a chest injury, Is that something completely different, or is there something maybe similar going on there? Like it might have been a shoulder injury, but they're calling it a chest injury just based off the area of that injury.
Yeah, so I think when he landed on it, I mean, that's a classic like clavicle or AC injury. I mean, just plain as day. You wonder then if it's maybe instead of the AC joint, the opposite end of the clavicle is the SC. So the S being sternum, so sternoclavicular joint. Those are much less common injuries, but they can certainly happen. I mean, you saw he was in quite a bit of pain. So you're like, all right, that's not just a bruise. So, I mean, when they're calling it chest, I'm guessing that's going to be a sternoclavicular injury. And I think you'd seen something, was someone reporting that, or was that just a guess? I think you'd sent me a little thing on that.
Yeah, I think it was like the Pro Football doc, or left the ambulance with a chest wound for sternocleidomastoid. Yeah, exactly. So
yeah, so I mean, I think that's a really good guess because I think a sternoclavicular injury would fit because you load it, and when the energy goes in, it goes through the clavicle just like it does with in other injury, but in this case, the sternoclavicular joints where it takes the hit. Now, SC joints are a little unique because you can break that joint, so you can have a fracture. Generally, it's of the clavicle, but a little bit rare, but they can happen. More commonly, you'll get actually a sternoclavicular dislocation, which is one of the things that I'm guessing why he went to the hospital, because the sternoclavicular dislocation can be an emergency. If it dislocates backwards, it can push on some really major structures. I mean, right behind your sternum is your aorta, your trachea. So those can be truly life-threatening injuries. And so my guess is if he was severely painful, it's hard to get a good assessment on X-ray alone, which all NFL stadiums have X-ray. Some even have CT and MRI available right there. But I'm guessing they said, look, we need to figure out this SC joint. And so I think that all fits with an SC injury. And then, of course, it's a very good sign that he came back with the team, meaning it was not dislocated, because if it was, it'd be surgery, usually relatively urgent surgery. So I think it probably was a sprained SC joint, maybe a subluxation, something like that, but it sounds like it may be not as severe as first thought. Timeline of those is really variable because I'm sure that's going to be the next question is like, how long will he be out? I mean, in theory, if it's a stable joint, it's like an AC separation. Like you can go back when you feel comfortable. The problem is those tend to hurt a lot. It hurts mainly with like lifting your arms up and out, which turns out wide receivers do a lot, whether it's catching or blocking. So this, I'm guessing, is going to sideline him for a bit. The question is it going to be season ending? I don't think that, but it certainly would affect my guess is into the playoffs, or at least close to that. But we'll see how severe the injury was. But I think it does fit to be an SC injury. I bet that's what it turns out to be.
Really quick, last one for you, because we were kind of speculating about him on Friday, TJ Watt, and then JJ Watt, his brother, breaks the news that he underwent surgery to stabilize and repair a partially collapsed lung after dry needling treatments that he was undergoing at the facility. So, I mean, from my understanding, is that needling treatment to relieve like some like kind of a physical therapy type of thing, or how rare is this to happen?
Well, to get a collapsed lung, a pneumothorax from dry needling is like insanely rare. I mean, so those are done by physical therapists. Dry needling can be a fantastic treatment option. I have a lot of patients that get dry needling done, and so I would not tell your listeners to be scared of dry needling. I mean, that is beyond fluke. I mean, it's almost to the point where it's like, is this like not necessarily even directly related? I don't know, because I mean, the needles they use are like acupuncture needles, so to like puncture along with that is just, I'd say fluke is just almost a step beyond. I mean, it's just really almost unheard of. So it is a very safe technique. So I don't know if he had. Sometimes you can have like little what are called blebs. So it's like a little pocket of on the lung lining that's weak, and maybe a needle hit that, so it like hit a weak spot or something. But it's really weird to have it. And then to take it a step further, I'm assuming when they talk surgery, they're basically saying they put a chest tube in, because that's how you inflate a collapsed lung. So he probably had a chest tube placed, and then they keep the chest tube in that reinflates. So basically the problem with the pneumothorax is you get air. You're like, wait, you want air in your lungs. Well, your lungs aren't just like a random cavity. The organ itself fills your chest. And so if air gets between the lung and the chest wall, that's what a collapsed lung is. And that can be dangerous because it doesn't allow the lung to inflate. So you need to remove the air. Now, if it's small enough, you just give it time and the body does it naturally. If it's big enough, then you'll put a chest tube in. So you slide a tube between the ribs and the lung, and you evacuate that air. And then once the kind of lung gets a chance to heal up, you just pull the chest tube back out. So that's almost certainly the procedure, or quote unquote surgery, that he had done. So long term should be fine. He's certainly going to miss some time. I don't know if they've actually given a timeline on it, but usually you can't avoid, or you need to avoid, like impact and heavy lifting, which clearly football has. So he may be done for at least a handful of weeks, if not the season. I'm not sure if they've actually announced that yet or not, but that's likely what's going to go on there.
Man, what that's got to be just awful, knowing it's not even like a football injury, right? I mean, it was.
Yeah. I mean, it is basically, it's like these tiny little needles. And it just, again, it's a very, I mean, I've had countless patients get dry needling, and generally the response is very favorable. I don't think I've had a single complication ever in any of my patients. So it's just, I mean, talk about fluke. I mean, that's like go buy a lottery ticket kind of stuff.
Man. Well, Austin, we appreciate it. I know we had a lot of people chiming in right now saying tell the doc thanks for popping on this morning. So we appreciate you taking some time, because yesterday is one of those days that we got to get the expert on. So we appreciate you hopping on and giving us your insight, man. Big thanks.
Yeah, it was. They were dropping like flies yesterday, but yeah, I mean, it's part of the game. Hopefully, these guys all bounce back well, and that's the amazing part of what surgery can do for people now. So hopefully, it gets everyone back out in the field playing.
Exactly. Well, hey, you have a good week, and we'll catch up with you again in a few days. Okay, bud?
Sounds great.
All right, there you go. Dr. Austin Crowe, Chippewa Valley Orthopedics and Sports Medicine.